Afternoon, everybody. Thank you for joining us. We're going to go ahead and get started, and we'll start with interpretation instructions.
Buenas tardes a todos, muchas gracias por unirse. Vamos a comenzar, pero vamos a comenzar con unas instrucciones acerca de la interpretación. Para los que gusten disfrutar de esta junta en español, cuando la función se prenda, aún no se ha prendido, pero si usted está utilizando una computadora, buscará el icono de un mundo que aparecerá abajo de su pantalla y luego seleccionará español. También los invitamos a silenciar el audio original. Si están utilizando teléfono o tableta, se mirará un poco diferente. Buscarán los tres puntos en la pantalla que digan More o más en español. Deslizarán arriba al menú de opciones donde saldrá la opción de interpretación cuando se prenda. Y luego ya después seleccionarán español, una vez más silenciar el lado original. Y cuando han acabado, si ya actualizaron, solamente tienen que presionar en otro lugar de su pantalla. Pero si aún no, puede aparecer un botón que diga listo, done o finalizar. Selecciónelo para de esta manera poder ingresar al canal de interpretación. Muchas gracias. Good afternoon, everyone. We'll be providing simultaneous interpretation. For all those who would like to hear any comments or questions made in Spanish, you can access the interpretation channel by looking for the globe-like icon that will appear at the bottom of your screen. From there, you'll select English. If you're using a cell phone or a tablet, you'll look for the three dots on your screen that will say More. Then you'll go up to the menu of options to where it says Interpretation. It will appear once it is turned on. You'll then select English, and then you may just have to click out of the screen, or maybe there'll be a button that will say done or finalize in order to hear any comments made in Spanish into English. Thank you so much.
Thank you. I'll go ahead and turn on interpretation now. Okay, can we get a thumbs up that that's working? Great. Okay, and if we could go ahead and start recording, please. Thank you all for joining us today. My name is Heather Ryden, and I'm with the Western Center for Agricultural Health and Safety at UC Davis. You are here for our May seminar series. Next slide, please. We'll go over a few housekeeping items before we get started. The seminar is being recorded, and that means it will be available to view both in English and in Spanish in the next few days on YouTube. All participants are muted. However, you can use the chat function to submit questions for the Q&A session at the end of the presentation. And as we heard, Spanish interpretation is available, and you can choose English or Spanish using the interpretation language selection below. That looks like a globe. There's also closed captioning, which you can select. Next slide. If you're new, welcome. We are really happy to have you here. The Western Center for Agricultural Health and Safety is one of 12 NIOSH-funded ag centers, and our mission is to improve the health and safety of agricultural workers in the West. We do this through innovative research, interactive training, and tailored outreach. And so today we'll get to hear sort of one of the ways that we share research findings with the community. Next slide. So with that, I'm really happy to introduce Dr. Laura Coco, an assistant professor at San Diego State University, who is one of our pilot feasibility awardees, which means she's applied for and received a grant from the center to look at agricultural noise exposure. With that, I will turn it over to you, Dr. Coco.
Wonderful. Thank you so much. Share my slides. It's wonderful to be here today. Thank you all so much for your attention, and I'm happy to share my project that was funded by a pilot project and by pilot funding from this wonderful organization. And today I'm going to talk about agricultural noise exposure. I'm going to start with a brief personal introduction and talk about how I became involved in this work, both in audiology and in agricultural noise exposure work. And then I'll talk about hazards in agriculture, focusing on noise. I'll focus in on the local context where I'm at and where I do this research. And then I'll talk about the methods of this research and the results, lessons learned, and what's next. And then we'll leave some time at the end, and I hope to engage you all in some discussion and Q&A. So just a brief personal background about myself. How did I get involved? I'm an audiologist, which is a professional who works with people who have hearing loss or at risk for developing hearing loss. But personally, I am involved in this work because these are my parents, and I'm a CODA, which is an acronym you may recognize from a movie called CODA, or maybe you've heard of that word before. It's a CODA stands for Child of Deaf Adults. So my dad was born deaf, and I have other deaf family members, deaf aunts and uncles, and they're here in this picture doing the ASL sign for I love you. So I grew up using American Sign Language, and that's how I knew about audiologists and deafness and hearing loss. So that's kind of my origin story as an audiologist. But I didn't always think I wanted to work in hearing loss and work in audiology. My undergrad was in something totally different. I had kind of a winding path. But then after undergrad, I ended up living in rural Mexico, and I was volunteering for a nonprofit where I worked with a speech and hearing clinic. And it was at this speech and hearing clinic where I learned about rural and low income barriers to hearing healthcare access. And this is a picture of me with a patient, and he is doing his own hearing test, and he's doing a great job at doing it himself. And this clinic was the only low cost clinic in the whole state at the time. So people would take a bus or drive 8 hours to get to the clinic in order to get a hearing test or hearing aids at a price that they could afford. And I learned there again about the barriers that people experience to accessing hearing care. And then when I returned to the US to do my graduate studies in audiology, I learned that people in the US have very similar barriers, maybe not to the same extreme or the same extent, but we have similar barriers in terms of geographic barriers to reach an audiologist, costs, and stigma. We have a lot of the same issues. So that's why I started to get involved in audiology and in disparities research. And then how did I get involved in working in agricultural research and working with farm workers preventing noise exposure? Well, this is a picture of us at a health fair at a nursery after I went to school for audiology, and I got my PhD and got more involved in research and teaching. I arrived at San Diego State, and I've been here for 3 years. Well, 3 years ago when I arrived, a friend of mine in Yuma was organizing a health fair and was looking for a Spanish-speaking audiologist to deliver hearing services, hearing tests for farm workers and their family members at this health fair. And so I volunteered. She asked me, and I said that I would join. And so I started to get involved in this work ever since then, and I haven't turned back because there is such a need for these services, but also on the research end, there's such a lack of research in this area. And so the more digging I did, the more I realized that there's really a need, which I'll talk about more in a moment. So this group probably realizes more than anyone that there are a number of hazards that farm workers experience when they're working in the fields. We know about heat, especially I'm in San Diego, so in the Southwest and places like Yuma and Imperial Valley, heat is a real concern. It's a huge hazard. Musculoskeletal injuries, another big hazard. And then, of course, pesticides and chemical exposures. But an under-recognized, underappreciated hazard is noise. So noise is an additional hazard that works doesn't work in isolation from all these other hazards, but it's in combination. So I'm showing a machine here and also an image of a little foam earplug that is used for hearing protection. Hearing loss is common among farm workers. There have been studies in the past that have documented high rates of hearing loss in farm workers, but they tend to be dated. So they're older studies, and they tend to be focused in the Midwest and the Northeast. But among those studies that we have, they show high prevalence of hearing loss in farm workers. And that is in large part due to being in close proximity to these machines and tractors. And if you're exposed to noise for a long period of time or really loud noise, it contributes to stress and fatigue. And then, of course, the results, the outcome that we all know about that's related to noise is hearing loss. If you're exposed to noise for a long period of time and you're unprotected, then you run the risk of hearing loss, which has been found to be associated with injuries on the farm. Presumably because you're not hearing auditory alerts. And this is what's called a noise thermometer, which is used a lot at NIOSH and at OSHA. We converted this noise thermometer into something that's more appropriate for agriculture settings. So you can see at the top, that's like the more dangerous level, the red hot level, and at the bottom, it's the cooler level, the blue. And we've put decibel levels, which is how we measure sound levels. So at the top, we have a gunshot, which is 140 decibels. That's really loud. At that point, you have immediate damage to your hearing. And down low, loading or unloading a tractor, maybe it's not even running, it's 60 decibels. That's also the sound of just regular conversation. You can listen to that all day long and you won't have any damage to your hearing. So not every noise or not every roll on the farm is dangerous to your hearing. But plowing, for example, is in the middle. 2 hours of exposure to that is damaging to your hearing. So it has to do with two things, the level of the sound and the duration of the sound. Also the proximity to sound, but just for simplicity's sake on this thermometer, it's the level and the time. So fertilizing using tractors, you can only be exposed to those for 2 minutes without running the risk of hearing loss. And of course, we know people are using those or nearby those for much longer than 2 minutes. So this is kind of a helpful infographic for us to kind of wrap our heads around exposure levels and time. The area where I am working currently and have been working for the past 3 years is the US-Mexico border in the Southwest. So I'm in San Diego, but about an hour and a half to the east is the Imperial Valley, which is indicated in red. And also 1 hour a little bit east of that is Yuma County. And these areas are known, more so Yuma, but also Imperial, are known as the winter lettuce capital of the world because they grow over 90% of all leafy vegetables in the US. And it's a huge economic, it produces, a lot of winter vegetables, but also year round, it's a highly productive agricultural area. The main areas of the work that we're doing have to do with measuring and then addressing noise exposure on farms in this region, and then helping to inform policies that prevent noise-induced hearing loss. Our research questions overall are identifying, measuring the prevalence of hearing loss among farm workers in this region, and the farm roles that are associated with more severe hearing loss. Within that, we also want to identify the hotspots for noise on the farm. Like I showed you in the thermometer, not all equipment or roles or areas on the farm are going to be dangerous in terms of noise. So we don't want to overprotect someone. So we want to put the resources into those roles on the farm that are most dangerous in terms of noise. So I'm going to walk you through 2 phases of a research study that I've been involved with. And the first phase was at one of those health fairs that I talked to you about that I got involved with and a couple of years ago. And this is a massive event that is in celebration of farm workers, and it provides a lot of health services, but it's also a way to thank farm workers for all of the work that they do. And so we were asked to do hearing tests for the farm workers, but I had just arrived to San Diego and I didn't have a team, I didn't have equipment, and so I wasn't able to do hearing tests that year. And so instead of doing hearing tests, I just went and learned about what resources they had, what they needed. And so I developed this brief questionnaire. It was like 6 questions. And I asked, do you have hearing difficulties? Are you exposed to noise? Do you use hearing protection? And then we had a sheet where we referred people to community services, just trying to kind of get a lay of the land. And this is a picture of us, and we do have lanterns because the health fair happened in the middle of the night. It was from 2 a.m. to 6 a.m. because that is the time that the workers are available to, right before their shift, before the buses pick them up to go off to the fields. And these are my wonderful students who are troopers and stayed up all night in order to hand out hearing protection, show people how to use hearing protection, and also talk to people about noise exposure and kind of collect some fundamental data about if people feel like they're exposed to noise, if they think that they have hearing loss, and just talk to people about noise. So we talked to 132 people that year. The median age was 52 years, but there was a really wide range of ages, 18 to 81 years. Half were males and half were females. Everyone was a Spanish speaker. We did the surveys interview style, so we were just talking to people and asked them the questions out loud. 36% reported they either have or they might have hearing loss. So we asked them, do you think you might have hearing loss? And 36% said either yes or I don't know. So the majority said no, they don't think that they have hearing loss. We also asked, do you work in noise? And the responses were pretty evenly split between yes, sometimes, and never. But overwhelmingly, most people said that they never wear hearing protection. And then we found that the odds of having subjective hearing difficulties, so saying yes or maybe I might have hearing loss, was over 3 times higher among people who said that they work in noise versus those who did not, which makes logical sense. We learned a lot of lessons in phase 1. That survey was very short, but even a 5-question survey was too long in that kind of context. It's not the same as lab-based research where you call someone up, you make an appointment, you have them come in for a 2-hour-long appointment, you go through a bunch of surveys. It's not that kind of study. You have like 30 seconds of an interaction with someone because people are moving so quickly through this health fair. So even a 5-question survey was too long. So we had to get pretty creative about how to make our questions efficient and brief. And the feedback helped us refine our wording. So to make it more culturally appropriate and more meaningful. And interestingly, the people who came to our booth were more interested in the pens that we had. And they weren't fancy pens, they weren't special pens. We were giving out pens and earplugs, and people kind of didn't care as much about the earplugs and they cared more about the pens. And I'll get to that in a moment about why that might be. But there was a lot of interest in getting hearing tested. And I mentioned that I couldn't do hearing tests that first year because I didn't have a team really. I had those 2 wonderful students, but I didn't have a team set up. I didn't have any equipment. I just arrived to San Diego. And I'm kind of glad I didn't aim to do a hearing test because it was so loud there. It was a huge party. They had a band, they had raffles, everyone was having a good time. But to do a hearing test, you really need a quiet space. So, but the good thing is a lot of people we talked to were interested in getting their hearing tested. They mentioned, they hadn't ever had a hearing test before, and so we were determined to come back the next year and get some objective data, which would help the research and also help the community by giving them some important feedback. So then we had phase 2. And this is our mobile health unit. Well, it's not ours. We borrowed a mobile health unit from the Arizona Prevention Research Center. We've since borrowed mobile health units from multiple different agencies. Still on a wish list of mine to get my own or a mobile health unit that we can use more permanently. But a mobile health unit is crucial for us to do hearing tests, again, to ensure a quieter environment. But in phase 2, we were able to do more extensive hearing screening. So rather than just rely on subjective data, we did hearing screenings. We did a more in-depth survey because while people are sitting down to get set up to do their hearing screenings, we could ask them more questions about their hearing health and more about their subjective experience with hearing. We did otoscopy, which is just a visual examination of the ear, tympanometry, which is a pressure test, moves your eardrum back and forth. So just some ways to tell about your ear health. And then pure tones, that is a way to test your hearing sensitivity. So the softest sound that you can hear. And from that test, I can tell you if you have a hearing loss and the degree of your hearing loss. And then we did referrals to community services. And we also did our own follow-up, which I'll talk about in a moment, where we came back a month later and did ear cleanings and hearing aid fittings to folks who we identified as needing those services and wanting them, of course. So in phase 2, we had 113 people. The median age for that phase was 54 years. These were all different people. The range for this group was 18 to 70 years. Again, 100% Spanish speakers, and also, again, 50% men presenters. From the survey results, we found that a very small fraction, only 13%, said that they were provided hearing protection by their employer. And the vast majority, 82%, told us that they never wear hearing protection while they're working. This bar chart shows their subjective hearing ability. So we asked them, how well do you hear? And then I grouped them fair and poor and excellent and good. So this group, the majority said that they do not hear well subjectively. So almost 60% said that they felt like they did not hear well. And then we looked at the prevalence of hearing loss. So hearing loss can be described or categorized a lot of different ways. There's not just one way. And we don't talk about hearing loss in terms of percent loss. But here are some different ways that we can talk about it in terms of low frequency, like low pitched hearing loss. And among our 113 people, almost 60% had low frequency hearing loss. And then we can talk about hearing loss in terms of high frequencies or high pitches, like flute. And over 60% had hearing loss in those high pitches. And then again, this is the subjective hearing loss. 60% had hearing loss in that range. I wanted to compare this with a study that was done in 2008. There haven't been many studies at all on this topic. This is the closest study that we could find because this study was done in a population that included 75% Latinos, and it was done in Connecticut. So definitely not a one-to-one comparison, but it is the most similar that's out there. And so there's 150 farm workers that are primarily tobacco farm workers in Connecticut. And there, I'm just comparing the prevalence of hearing loss in that group. And so it appears a much smaller prevalence of low frequency hearing loss, similar high frequency, but a smaller prevalence of subjective hearing loss. So I'm not quite sure why that is. It could be the difference between timing. So that study was done or published in 2008. And there could be a lot of changes in how farms are, and how tobacco is farmed, and how these are primarily lettuce farms. So the machines that are used on those farms, and also the how farming has changed across the years. The methods are pretty similar between the two groups, but there are some slight differences. So just interesting how the two studies differ and how they're similar. This is our study again, and it's showing the prevalence of hearing loss on the y-axis and then age quartiles on the x-axis. So hearing loss increases with age. That is probably obvious if you have anyone in your family who has hearing loss. And that is also true for our group. It is extremely difficult to separate out the variables of noise exposure and age. And as you can see in our sample, if you look at our first quartile compared to the fourth quartile, the 34-year-olds have much less hearing loss than the 64-year-old. So definitely age has a lot to do with the prevalence of hearing loss. I'm going to walk you through this table. We're looking at the associations between hearing loss and demographic, occupational, and noise exposure factors. So if we look just at this top line here, we have age and hearing loss, and you can see that age is significantly associated with hearing loss. And then years of agricultural experience are also strongly associated with hearing loss, but sex or gender is not associated with hearing loss, and neither are perceived noise exposure, equipment type, or whether or not their employer offers hearing protection. I'm also showing adjusted odds ratios. So when we add in other factors into the model that are listed here in the variable list, and we find that I've highlighted here to make it a little bit easier to see. We find that age, years of agricultural experience, perceived noise exposure, and equipment type are all significantly associated with hearing loss. So we look at age, for example, we can see that each year of age increases the odds of hearing loss by 14%. But also years of agricultural experience is independently associated with hearing loss. And so this is interesting. Perceived noise exposure is as well. It appears to be independently associated. So people appear to be pretty good at identifying that they are exposed to loud noise. So if we take into account that obviously it's good to objectively measure people's noise exposure, but just asking them, do you think that you work in noise, seems to be a pretty good predictor of whether they're exposed to noise and have hearing loss. And then the last one, using machinery like tractors and packing machines, was actually linked to less hearing loss after adjustment. And so that might mean that some equipment is better protected, like enclosed cabs, but we're really looking at that equipment type variable more closely because it's compared to an other category, which is we just had a lot of different pieces of equipment in that other category. So we're looking at it more closely. We had some questions that had open-ended responses, like what is your role on the farm? And again, what machines do you work with? And we tried to categorize them, but there were lots of different answers. The majority of people, when we asked what is your role on the farm, the majority of answers fell into the category of harvesting and planting and packing and cleaning produce. But then again, there was a big other category like cooler worker, and same thing with what machines do you work with? A lot of people said it's just the machine. Like they didn't know the name of the machine, which is completely understandable. But for the purposes of comparing groups and running some statistics, it's helpful to have names of machines. But a lot of people said that they worked with packing machines, forklifts, and tractors with and without cabs. Here I'm showing the percentage of hearing loss by primary role in agriculture, like I showed the previous screen. So there was a pretty even split based on these categories of roles that we put people into these buckets based on their open-ended response. But again, we have this big other category that we'll be looking into more. And then again, like I said, the farm equipment type, we had similar prevalence of hearing loss across all farm equipment types. Tractor with cabin, without cabin, packing machines. So in one of our research questions was to identify kind of the hotspots for noise and identify one way to do that is to identify maybe one equipment type has people who work with one equipment type have more hearing loss than others, and we're not really seeing that. But again, we're looking more into that other category as we dive further into the data. Here I'm showing a predicted probability plot with years of agricultural experience on the x-axis and predicted probability on the y-axis. So as we go higher on this graph, we get to 100% probability of estimated risk, basically, of a high frequency hearing loss based on years in agricultural work. So as we go further to the right on the x-axis, we're getting more years in agriculture. And you can see as you work longer in agriculture, your risk of getting hearing loss increases. And according to our model, if we just pick one, this is accounting for age, so holding age constant. And so if we pick, just for example, for the sake of conversation, if we pick a 49-year-old with 15 years of farm experience, then they have a 67% probability of having a high frequency hearing loss. And I want to share with you a few case examples. These are not the individual's real pictures, but I'm hoping that this can kind of humanize the data a little bit. These are real examples of individuals that we have met from our research. A 65-year-old female who has worked in agriculture for 27 years. Her main role when we met her was cutting kale and cilantro. And she said she works near an air compressor, which is very noisy. And she was discussing that she has tinnitus, which is a ringing or buzzing in the ear that for some people can be extremely bothersome. It can prevent you from sleeping and focusing and concentrating. And after a hearing test, it turned out she had moderate hearing loss. Again, no way to know if the moderate hearing loss and the tinnitus is a result of noise of working near the air compressor. It could also be a synergy between noise and chemical exposure. It could be three things: noise, chemical exposure, and age. But definitely noise does not help and could lead to is a common factor in tinnitus and hearing loss. Another individual we met is a 31-year-old male who has worked in agriculture 12 years. When we met him, he was cutting lettuce, and he works near a packing machine, and he also had tinnitus and mild hearing loss. So tinnitus is kind of a hallmark of noise exposure. Of course, people have tinnitus who don't have hearing loss and noise exposure, but it is very common. We also found in talking to people that noise exposure is not well regulated. In many industries, noise exposure is regulated, and if employees have a certain amount of exposure, then the company is required to have a hearing conservation program. Agriculture is not one of those. And so that's why in the survey you saw that the majority of employers do not provide hearing protection. And when we asked people this, does your employer provide hearing protection? We heard algunos sí, otros no, which means some yes, others no. So it's not consistent. And another person said, cada compañía tiene sus reglas, which means every company has their own rules. And another said, no, no están permitidos, which means no, they're not allowed. That one was kind of shocking to us that they're not allowed. So even if you were to bring your own or try to use them, they wouldn't be allowed. And that individual told us that nothing is allowed in your ear. So if you were to wear AirPods or earbuds to listen to music, that is not allowed, which kind of makes sense because of a safety thing. But that individual is not even allowed to wear earplugs because also of safety in case a forklift were to come up from behind and they wouldn't be able to hear the forklift and they may be injured. So that explains, if you can remember many slides back, when we were giving out earplugs and pens, and people were really going for the pens rather than the earplugs. And what kind of motivated me to do this work in the first place is that a lot of the work that I had seen was focused on trying to get farm workers to wear earplugs, and it's really not that simple. It's not that simple if there's no regulations and if some people are being told you're not allowed to wear earplugs. So it's not really up to them. And so we shouldn't be focusing on this, just encouraging farm workers to wear earplugs as our sole intervention and our sole efforts. So, as I said, for some individuals, earplugs are not allowed because of safety. And I totally understand the safety issue. And so we're trying to work on a happy medium to maintain safety while still maintaining or preventing noise-induced hearing loss. Because at the beginning of the presentation, I mentioned that if if noise results in hearing loss, that also could lead to increased risk of injury on the farm. So there has to be a good compromise. And this individual told me, es perder el oído o perder el trabajo. It's either lose your hearing or lose your job. So that can't be the reality. There has to be a better way. I mentioned earlier that we do provide follow-up services. So we do go out into the community and do these hearing tests as a part of research, but also a community service. And we can't obviously just identify these folks and then leave. They don't have a lot of local services, and hearing aids are very expensive. So we have been going back to do hearing aid fittings in collaboration with with Judy Hutch, who's a fantastic audiologist in Arizona. And here she is doing ear irrigations, which is ear cleaning. We found a lot of impacted earwax, which we have to address before we do any hearing aid fittings. And here I'm showing a woman how to do a hearing aid, how to put a hearing aid in her ear. And here's a link to the YouTube video. I'm not going to play it right now because I'm going to run out of time, but I'd love to share that with you, and you can watch it if you have time. And it's just a kind of summary of the follow-up services that we offer. We're also doing some ongoing work that is trying to address some of those initial problems that I mentioned at the beginning of the talk, which are, what are the hotspots for noise? How can we identify and then address what equipment is related to the most dangerous noise exposures? And to do that, we really need to rely, well, we have the subjective self-report data, but we really also need objective data. And to do that, we use dosimetry. Dosimeters are, they have different kinds of dosimeters. We use a noise dosimeter, which is a little microphone that you attach to your sleeve or your shirt. And the farm worker, the participant, wears it all day long during a work shift, and it has a data logger on it. So it calculates and it averages the noise level throughout a day, and then it calculates your noise dose. So is it over 100%? And then that might be you working on a tractor for 8 hours a day, and I'm sure there's moments of quiet, but average throughout the day, it was over your noise dose. So we have another YouTube video that helps orient farm workers and the promotoras that are helping them to how to use the dosimeter. Here is a screenshot of it right here. It's pretty easy to use, And these dosimeters are very hardy and durable. So it gives us very helpful data. Another last piece of outreach or of ongoing work that I'll share is outreach. And we're always going out to the field and sharing information. Of course, we share earplugs and how to use them, even if they're not easily implemented in the field. We're still plugging away at in at multiple angles of this issue. We also recently started. And here are some photos of me doing hearing tests in a mobile unit. This was just last week, so very recent pictures. We also recently started talking to folks about avoiding using Q-tips. This issue came up out of a community need, a community issue. It's not our primary intention or something that we thought we'd talk about, but after looking in a lot of ears, I've seen a lot of broken Q-tips in people's ears, and Q-tip, like the cotton part of a Q-tip, just stuck in someone's ear canal. So the wonderful students in my lab created these infographics which try to convince people to stop using Q-tips, and they talk about how your ears are self-cleaning and they work the wax out naturally. So we just debuted these last week at a health fair, and I think they're a hit. So part of the goal of the lab is to promote ear health, and this is part of that goal, advancing that goal. Overall, the lessons that we've learned is that this is a highly mobile population. So again, it's not easy work like just calling people up and inviting them to the lab and booking a visit. It takes time to earn trust in communities. And so this is long-term ongoing research and community work. And we also have to work within the constraints of employers, which can be very challenging, but also makes it very gratifying and sustainable when you have buy-in and appreciation and collaboration from multiple groups, community groups, employers, and farm workers. There are also a number of opportunities that this work offers. My students are extremely engaged in this work. Some of them come with personal experiences from farm work. Their family members may have been farm workers from like generations back. Maybe I do have a student who grew up on a farm, and they love going out in the field, out in the communities. You can see in this picture. And also noise is an addressable hazard. It's completely preventable. So that's another opportunity that we can offer. And the community appears very interested. They're interested in health overall, interested in hearing health. And then this project and this work overall has a potential to inform policy and really make improvements in hearing health. So if you take away anything from this talk, I would love for you to take away that hearing loss is common in agriculture, especially among those who are exposed to noise and people who have worked in agriculture for many years. Workers tend to know when noise is too loud. So if you think your workplace is noisy, you're probably right. We're going to add to this by we're already starting to collect some more objective data. And just providing earplugs isn't enough. Some workers aren't provided them, and not all farm roles are equally noisy, but we also need support from employers and policy to enforce these regulations. And we can prevent hearing loss with testing and outreach and policy changes. We can protect hearing without risking jobs. So our future directions are to measure hazards on farms, to provide on-site ear care and hearing aid services, so kind of an all-in-one package. And we are looking forward to new and strengthening our ongoing collaborations to prevent noise exposure. So I'd love to thank my collaborators, and I really want to thank the farm workers who have participated and all the farm workers across the nation for helping put food on our plates. And I really want to thank the group here for the funding that has allowed this work to take place and for inviting me here to talk. So I'll stop now and invite any questions you might have.
Wonderful. Thank you so much. That was fascinating and such important research in an area that has not been adequately researched. So thank you so much. I'm going to encourage folks to put questions into the chat. I see that we already have one from Dr. Fatala, the center's director. So he says that although agriculture is exempt from OSHA's hearing conservation program, noise risk would still be covered under the general duty clause. So in California, that's going to be your IIPP, Injury and Illness Prevention Plan. Do you know whether or not there's been any Cal OSHA citations or also in Arizona, since you worked in Yuma, related to noise exposure?
I do not, and I've talked to the Cal OSHA folks, and it doesn't seem like there are in that's being enforced. And so I'd love to hear if anyone has experience that differs from that. And I'd love to, collaborate with Cal OSHA and to find a happy medium on how these laws can both be more clear and how they could be enforced in a way that isn't burdensome and could be actually applied. So yeah, I agree that even though at a federal level it may not be applied, it's when you talk to folks on the ground at a local level, it's not being implemented. And
Sure.
I think part of that is because when you think about agriculture, especially crops, it doesn't seem, and this, I think this has been the case for decades, it doesn't seem like it would be that loud. But what we've seen from research is that it is loud, and I think it's becoming increasingly loud as like machines are becoming more prevalent, and and then you add on top of that, people are listening to music, and in their hobbies are extremely loud. So all these, it's all cumulative. So the risks are additive.
Absolutely, that makes sense. And thinking about those both workplace and non-workplace exposures and the cumulative effect of them. Um, you mentioned that other industries or sectors have some hearing protection requirements. Do you know how they handle ensuring the hearing protection while also being conscious of the surrounding hazards that might exist? So you mentioned tractors or a forklift in agriculture. There might be something different in another industry. How do they balance those issues?
I don't think any industry has solved it, but I think now is there's no better time than now to be thinking about these type of things because there are innovations like noise canceling headphones and even in-ear headphones that are passive and active, so you can turn them on and off. We didn't have those 10 years ago. We just had the foam earplugs. So there are ways to have like smart earplugs where you don't need to be 100% plugged up all the time. And then you can have custom earplugs that are fit to you, and fit testing is a new thing that's just been um, popularized lately where you're testing each individual's attenuation of their earplug. So I think that it's more like customized to the individual now. Um, but the way other industries do it is testing the individual's hearing and their exposure level. So it's not a blanket rule. Everyone needs to wear earplugs all the time. Oh, you're muted, Heather. Heather, you're still muted.
Thank you. Um, I was thinking about a different piece of that as I was listening to you present, which has to do with the wide range of equipment and noises in agricultural settings. And we go everything from planting to harvesting to post-processing and packing houses, etc. Is there a type of noise that is more damaging than others? And I know that's part of what you might be looking into in the future, but I'd love to hear more.
That's such a good question. Yeah. So, there are different types of noise. So we have like impulse noise, like I showed on the thermometer. Impulse noise would be like a gunshot, which is extremely short, but it's very loud. But different types of noise, like the frequency components, it really just it doesn't matter as much as the volume, the length of time, and how close in proximity you are. So if we think about like uh, the most effective way to prevent noise exposure is removing the source. Then the second is creating a barrier because all of those strategies are removing those first two things, the volume and the length of time. So yeah, the type of noise, like the source, the reason that matters is just because of the volume and the length of time that you're exposed.
That's the classic hierarchy of controls. So
Exactly.
all OSH, occupational safety and health people should be familiar with that. And if not, I know that we have an article on our website that can describe that idea of eliminating the hazard before moving on to other strategies. Um, so not knowing that research is ongoing and that earplugs are not sufficient, we have a lot of community members here who are working with farm workers on a daily basis. What would you recommend they communicate to farm workers now based on what we know?
Yeah, what an excellent question. So from our research, like I said, we found that people are good reporters of if they think they work in noise. We also give kind of the scaffolding of noise means if you can't hear the person that you're trying to talk to next to them, next to you. So if you have to raise your voice or if you have to ask what. So if you, I would recommend asking people if they think that they're working in too much noise. Also, apps on your phone are a really good replacement for these dosimeters, which are really expensive. And I wouldn't, ask anyone to buy one of those just for your regular workplace. So if you have a smartphone, you could download the NIOSH app, NIOSH sound level meter app, and that can tell you if you're in a place that's too noisy. I do that all the time at concerts and movies, and it's a good gut check that like, do I need to put my earplugs in or not? And then you could have earplugs on hand and then get creative about alerts that are not auditory. And that's just an inclusive approach anyway, because some people, if you have farm workers over the age of 65 or even 55, they're probably going to have hearing loss anyway. So including some safety alerts that are not 100% auditory, so some visual alerts would be a good idea as well.
I really like that. Thank you. Two more sort of one comment and question. We have a community member in the Central Valley who reported hearing from workers that they complained of headaches and dizziness associated, they think, with hearing jets from the Air Force base nearby. Are headaches and dizziness, are those common symptoms or signs of too much noise?
That can definitely happen. Yeah, I've heard that as well. And I was in one of the pictures, we were at a farm at a health fair, and there were Air Force planes that were going by, and I was covering my ears, and other folks weren't because they were just used to it. So that can people can have all kinds of reactions. They can feel sick to their stomach, and they can feel dizzy, but also you can acclimatize to it. So I was feeling that way, but then other folks who had worked there for years were like not noticing it at all.
Mm.
So I would see if that changes if you put earplugs in. The problem is that sound travels by bone conduction. So you're not just receiving that sound through your ear canal, it's vibrating, if it's intense enough, it's vibrating your bones. So um, if you live close enough to that Air Force base and there's no way to be 100% protected, maybe go inside.
Yeah. Okay. Well, thank you. Which unfortunately, like other hazards, farm workers and face going inside is oftentimes not an
Not
option.
an option. Yeah.
But it's good to know that there might be at least partial protection that can be achieved with the earplugs. So, last question, because I know that you actually are teaching in just a few minutes, but the director of our pilot feasibility program wants to know within this field, what kind of research do you think needs to happen? What are some research questions that exist that you think should be addressed?
I love that question. I think there needs to be more mixed methods in qualitative research. People need to actually talk to the folks who are at the end users or the people that we're doing research with, and we need to learn, like I mentioned in the presentation, kind of come to an agreement on a solution to how we can address noise exposure in a way that does not affect safety and allows people to keep working, because these are all in order to meet everyone's needs. I'm sure that there is a way to come to that agreement. It just takes conversations with everyone coming to the table, more of a community-based research approach. And I don't think that's been done enough in this field. And so I'm really excited for the future and for that to happen. I think there needs to be more um, more combination of subjective and objective. I think especially in audiology, we tend to put objective results on a pedestal. I'm sure that's probably this true for other fields as well, but subjective hearing and subjective reports of noise exposure, those are really important too, because if someone says, I think I have a hearing loss, and then we measure their hearing and they don't, well, why is that? Why do they think that they have a hearing problem? And so I'm really interested in um, the combination of those two measures. And then um, and then maybe the combination of how hearing loss and noise exposure impacts other outcomes like stress, depression, um, other health outcomes like that.
That's wonderful. Lots more questions to be explored, and really looking forward to seeing your research continue and answer some of these questions. I want to thank you so much for being here, Dr. Coco, and presenting. I have a feeling we'll be following up to see if we can write an article or create some resources to further expand the reach of the amazing work. Thank you all for joining us today. Have a wonderful evening, and we will see you back here the first Monday of June. Thanks so much. Bye.
Thank you for having me.